This training video demonstrates how to perform BTL Mcellar therapy. Start with a brief explanation that BTL Mcellar device uses high-intensity focused electromagnetic energy to stimulate pelvic floor muscles. The patient will experience intense contractions and a tingling sensation. Ask the patient about medical history and use the contraindications checklist and mark all answers. Here we provide you with the most important ones, such as metal implants, pregnancy, tumor, and heart disorders. However, do not forget to consult the operator's manual for the full list of contraindications, warnings, and cautions. Ask the patient to remove all jewelry, phones, any metal objects such as coins from pockets, credit and/or other cards prior to the treatment. Now is the time to learn about patient positioning. Instruct the patient to sit comfortably in the center of the chair. Firstly, set the height of the chair. Use the remote control located on the chair's backrest and set the height where the patient's legs are perpendicularly flexed and feet are flat on the ground. Put the magnetically attachable remote control back to the chair's backrest. Demonstrate to the patient the correct position of lower limbs. Perpendicularly flexed legs are in the slight abduction and external rotation. Make sure that knees are just above the feet, which are on the ground. Teach the patient the right pelvis position. The patient should sit as close as possible with the weakened part of the pelvic floor to the chair. Ask the patient to tilt the pelvis forward or backward according to the treated area. The last instruction is to keep a straight spine, and finally put relaxed arms on the thighs to maintain the position easily. Check if you have done all points. Finalize the position with therapy targeting mode. Choose any of available presets named according to the condition or patient's name and press Start. Therapy targeting mode is announced by flashing heading on the screen. Increase intensity in accordance with the patient's tolerance and wait for the feedback that the patient feels gentle pulses tapping over the perineum and pelvic floor muscles. Instruct the patient to move slightly forward, backward, or to the sides until the pulses will be tapping in the target area. The primary position of the legs should remain unchanged. Highlight to keep an upright position and straight spine. Check out additional therapy tips. In case that patient cannot position properly, demonstrate how to slightly put the gluteal muscles on the sides in order to find a proper position. After positioning, press Start to continue the treatment. Explain to the patient that you will increase intensity up to their tolerance. It is necessary that the patient experiences intense pelvic floor muscle contractions and tingling, but the therapy must not be painful. The therapy runs operator-free. However, it is recommended to check the patient condition during the therapy and, if necessary, readjust the intensity. The patient can relax during the therapy by reading the magazine or watching TV. The end of the therapy is indicated by the sound and flashing lights on the armrest. Always ask the patient for the feedback if everything is all right and there are no side effects. Check out the most common mistakes to avoid. Do not lean on the backrest. Avoid the hunchback posture. Feet must be always on the ground. Do not put the legs together. Do not cross legs. Do not put legs too much on the sides. Do not put legs into internal rotation. Do not put legs on the side.